Hello, I'm Llewellyn King, the host of MECFS Alert, this special YouTube program on the disease myalgic encephalomyelitis. I'm joined by my friend and colleague, Deborah Woroff, and this is a very special broadcast because it is 5 years since we started this program, a little short of 5 years, but close enough. And we're back with Dr. Derek Enlander, who was our first subject. Doctor, welcome to the broadcast after nearly 5 years.
Thank you very much.
What has happened in the interim?
Well, some very interesting things and some things that have actually remained status quo. The interesting things that have actually happened in the interim are that the government of the United States have shown some interest in this disease by actually incorporating the IOM in doing a research to determine what and where research should be in this disease, and actually how the criteria of this disease should be altered. This has actually caused some controversy because a lot of us actually have decided that the $1 million that was spent in doing these things could have been perhaps better spent in raw research rather than in semantics.
What has happened in terms of the two big issues? Diagnosis, a biomarker, and some treatment, having established who has the disease without shadow of doubt?
Well, the idea of diagnosis was one of the things that the IOM was supposed to...
Can I just say, for the benefit of our viewers around the world, the Institute of Medicine?
The Institute of Medicine, by the way, is not a government organization, so it's a relatively self-determined organization that the CDC have used from time to time in defining certain disease entities. The idea that the IOM defined that we don't know how to diagnose this disease, so therefore we actually had to set up new criteria or identify actually the criteria that was in existence. And the criteria that has been in existence actually for many years, obviously the Fukuda criteria, which has been in existence now for several decades, and the newer criteria, the Canadian consensus criteria, which included actually a peculiar additive that the patient suffered from a post-exertional malaise. This is called PEM. This post-exertional malaise occurred several days, perhaps, after the original exertion. If an average patient actually is exerted, the malaise, or the tiredness or fatigue, occurs a short time after the exertion. Whereas in chronic fatigue syndrome, according to the Canadian consensus, and a lot of us have seen this, the post-exertional malaise occurs 24, 36, or 48 hours later, and the patient actually suffers from this malaise. That actually, I think, was a truly changing, a thought-changing idea that is not actually seen in other types or standard types of fatigue. What actually we're doing actually with regard to treatment and objective diagnostic methods are that we now actually have almost certainly proven that there is an immune system relationship. An immune system relationship is actually derived in both actually the idea that antibodies might actually be involved in the disease, or that there might be a cellular response and cytokine response in the disease. Natural killer cells are decreased. CD4 cells, a certain type of T cell in the immune system, can actually be reduced. CD8 cells can be reduced. Certain cytokines can be abnormal, and certain IL-2 and IL-4, IL-8 cytokines are abnormal.
You practice here in New York, where we are filming, but also you see patients in London, Belfast, and Dublin. Do you find differences in these countries? Do you find patients suffering differently, responding differently? And what is the feeling you have towards the governments in those countries? Three governments. Governments tend to have different attitudes to this disease.
I retain my British license, as you can determine. I actually.
You are a native of Northern Ireland.
I'm a native
right?
of. I'm both British and Irish. Proudly, both British. Proudly Irish. I have spoken actually frequently. I see patients approximately twice a year in either Britain or Ireland, and one of my patients in New York, very actually magnificently, came up with a donation of $1 million towards my research, and I told him that not to give it to me, but to actually give it to Mount Sinai, because he would get actually some tax benefit by actually giving it to a charitable institution. He gave it to actually Mount Sinai, and the dean of Mount Sinai, in my presence, actually said, well, we're going to actually find a center for chronic fatigue syndrome. And indeed, he did. And we actually have now got the first major medical school in the United States, if not actually worldwide, that has a center of chronic fatigue syndrome.
I have just a few more questions, one of which is, when we talked 5 years ago, the only sort of ameliorating drug available was Ampligen. A few others that treated some symptoms, but not the whole thing. Now Ampligen is getting less attention, and you yourself, who used to prescribe it, do not do so.
Ampligen actually has a rather checkered course. It's been used actually now for decades. Certain patients actually have actually benefited from it very, very much. In fact, some patients actually claim that without Ampligen, life actually would be impossible.
I've spoken to such patients who said they couldn't get out of bed without it. And
Absolutely,
some have moved,
absolutely correct.
Have moved to doctors or to localities where they could get the.
Yes.
The other drug that comes up is Rituxan, which is actually it's an off-label use of an established cancer drug. What are your feelings about that?
Well, let me actually finish with Ampligen first.
Sure.
Ampligen, as I said, has had a checkered career. It still is not FDA approved, which is sad. Sad actually, not only from the hemispherics company standpoint, because they have been unable to actually get research actually accepted by the FDA, and the FDA has thus not given its approval for its use. Rituximab, on the other hand, is a drug that is FDA approved, but FDA approved for chemotherapy for B-cell lymphoma. B-cell lymphoma actually was treated by Miller in Norway, and found actually that some small number of patients who suffered from B-cell lymphoma had previously had chronic fatigue syndrome. And lo and behold, the chronic fatigue syndrome actually ameliorated with the rituximab. Does that actually give us freedom to actually say that we should use rituximab universally in chronic fatigue syndrome? Perhaps not, because after all, rituximab is a chemotherapeutic drug and has dangerous side effects. Dangerous side effects being death. Mello actually admitted patients to the hospital prior to the administration of rituximab. So it is not actually a drug that some doctors have actually given as an outpatient method of treatment. I think that's very dangerous, and I think that's foolhardy. I think it's cavalier. This is a drug that has to actually be looked at, further investigated, and I think actually it might actually show promise.
Research, you mentioned research. Is this becoming stovepiped? Are we seeing, for example, here in Manhattan, you mentioned Mount Sinai, and then we have Columbia across the park, also doing research. To what extent are these melded together? Are you sharing information?
We are only too willing to share information. Unfortunately, we have not actually we have not seen actually any conjoint efforts by other people in New York to actually meld. Maybe actually they're jealous. Maybe they're jealous.
Or
actually
elsewhere in the country. I mean, there's
we actually have
in California. There's research in Nevada. There are little centers in California, in Florida. There are little centers of research, but there is no sort of huge cohesive national effort, is there?
That is true. That is true. Very sad.
How are we going to get that going?
I think actually the organizations have got to actually meld together work groups and research groups actually to actually interact. For example, we looked at the possibility of a substance that had been discovered by Yamamoto in the 1990s.
Where is Yamamoto based?
Yamamoto was a research physician in Philadelphia, obviously of Japanese ancestry, and he actually developed microsite activating factor, MAF, and MAF was used actually by Yamamoto for viral disease and also for cancer. Unfortunately, his research actually became ahead of itself in the PR department that was attached to his group, and claims were made actually about cancer and viral cures that perhaps actually were premature, with the result that people actually then threw up their arms and said that Yamamoto actually was making claims which just could not be verified. And his research actually was then actually forgotten until about actually 5 years ago when a group in England actually decided actually to start manufacturing MAF, and another group in Belgium made MAF. The group in England, unfortunately, was headed by a non-physician or a non-medical personnel, and the British government closed them down because the plant that the MAF was being made was claimed to be non-sterile by the British Department of Health. They then moved actually through various places in Europe, and actually have actually had mixed success. Whereas the Belgian group produced a very good quality MAF, but because of the abnormality in the British manufacturer, the FDA said any MAF, no matter whether it's British or Belgian or from elsewhere, was going to be banned, and we could not use it. We had originally looked at the possibility of using MAF in chronic fatigue syndrome, and find it actually to be quite interesting, because the macrocytes in the immune system are abnormal, and obviously the natural killer cells that I've mentioned earlier are also decreased. So MAF tended to increase the number of natural killer cells. But we actually had to adhere to the FDA regulation, and we could no longer use it. Then actually we were enthralled by Paul Cheney's work with Ruggiero in Italy to find that certain strains of bacteria, when they replicated, produced MAF. So a probiotic research group in Sinai discovered that certain bacteria, when they replicated in yogurt, or if the patient actually is lactose sensitive, in agar, that the probiotic bacteria produced the MAF. We called it MAF 878 because of the number of times actually that we had to go through replications to try and find the right mix of probiotic bacteria. And the probiotic mix, MAF 878, seems to also actually have a positive effect on patients. It's not as concentrated as the European MAF, which was given by injection, but we actually think it's going to actually produce good results. That, in combination with another substance called Gear Up and Gear Up Plus, which act on the methylation cycle in the immune system, we find actually that that also helps in the immune response in this disease.
I'm going to turn the questioning over now to Deborah Woroff, who is herself a patient, has suffered for decades from ME, and she helped me establish this channel and remains its strong co-sponsor and co-performer, if you will. Deborah?
Well, Dr. Enlander, I was hoping you could just let us in perhaps on one or two of the projects that the Mount Sinai group are working on now.
Well, one of the projects is actually to prove or disprove that, excuse me, that exercise helps patients with this disease. Is this a true method of treatment? PACE, P-A-C-E, is an abbreviation for a research group in England, which has actually published work saying that the method of treatment of this disease is primarily twofold. One is cognitive behavioral therapy, CBT, and the other is exercise therapy.
And of course, I want to explain cognitive behavioral therapy is the old every day in every way I am getting better and better kind of therapy, or the Manchurian Candidate kind of therapy, which actually originated with William James late in the 19th century. So it's not exactly a new thing, though under a new name.
So CBT and GET, graded exercise therapy, are the basis of this work. It has actually received a lot of adulation and indeed criticism, and nobody actually has really actually been able to replicate the work that was done in London. So we have actually taken it upon ourselves to take actually a group of patients, known patients, which have actually been carefully actually looked at with regard to Fukuda and Canadian consensus criteria, to actually determine that they indeed do suffer from chronic fatigue syndrome, because the census actually for patients who are not actually suffering from ME/CFS to actually be determined whether they're going to actually be helped or not helped, if indeed they're not actually initially properly diagnosed. If they're not officially diagnosed with a disease, well, we could actually be looking at patients who actually might actually be distressed, or might actually be suffering from something other than ME/CFS. So we are carefully actually making the distinction that these patients that we are going to actually identify are indeed ME/CFS patients. And then we're going to actually exercise them and simply actually determine actually whether they are helped or hindered. And indeed, actually, our initial results show that a lot of patients actually, 65% of patients are hindered, if not hurt.
Well, that fits in with a recently unveiled paper out of Barcelona saying that patients are hurt by the exercise part.
Yeah,
So-
well, ours is solely actually focused towards exercise.
Right.
And it's really, we can actually correctly be pointed at, well, this is just too simplistic. Well, it is a simple manner of approach, and we actually are not making vast claims because it's actually a relatively simple 100 patient ME/CFS patient-wide study.
But 100 patients is good numbers, especially by the standard of this field where we've had many small groups. And also replication is the standard of science. So if we have 2 failures to replicate, the other, Barcelona being much smaller, and one with 100 patients, that's very, very significant. That's an advance. What, do you want to share any other work that they're doing now? Perhaps one more?
Well, we're looking at basically methylation cycle, excuse me, methylation cycle treatment using actually the Gear Up Plus substances that act on methylation cycle, in addition to methylcobalamin, B6, zinc, and other trace metals.
Gear Up, where do people get that from? Is that on the market or?
It's manufactured by a small company in Long Island, New York.
Oh, interesting. And when would you expect results from that?
Don't know.
Is it open-ended?
It's open-ended.
Okay,
Yeah.
well that's interesting. Well, looking at this 5-year period, what progress have we made? We being the world scientific community, say, what progress has been made in the understanding and treatment of ME/CFS? Is it 0? Are there 2 or 3 things we can point at that have benefited patients in understanding or treatment? What would you say, being someone who looks at the entire field and on both sides of the Atlantic and Pacific?
Well, as I said, actually, the IOM was chastised by a number of people because of the amount of money that was being spent.
Right.
However, in favor of the IOM,
The Institute of Medicine.
the idea was that we actually could see that there was now a massive amount of information actually being brought to the table, and that there was a great interest, worldwide interest, because the newspapers actually all of a sudden said, oh my goodness, the government actually have employed actually this body of experts, which indeed actually was a question amongst many, to define and actually to declare that this was not a mental instability, this was not an imagined issue, that this was not something that patients were thinking that they had and was not actually an actual problem. But indeed, the IOM said, this is a disease. This is a condition that has to actually be looked at carefully.
I think that's a great point to finish on. Thank you very much, Dr. Enlander. Nice to see you again. Let's not leave it for 5 years. Deborah, thank you very much for your incisive questions.
Thank you very much.
It's a great pleasure. Thank you.
Pleasure.